Thank you so much, Dr. Rosenbaum. And that was an excellent introduction to this panel. And like you said, we have a great lineup of speakers this morning. Let me just share my screen quickly. So this is a very exciting time to be studying psychedelics. We're really in the midst of a psychedelic renaissance. These substances were studied in the 1950s and 60s by Western scientists. Of course, they've been around for thousands of years. Many psychedelics occur naturally in a variety of plants, fungi, and even some animals around the world. And there are indigenous cultures that have been using them for hundreds or thousands of years. But they were studied as therapeutic aids in the 50s and 60s until they were prohibited at the start of the US war on drugs in the 1970s during the Nixon administration. But in the 1990s, a small number of scientists gained permission from the government to start some research, and research that started as a trickle in the 90s has become a stream of innovations. And especially in the past 2 or 3 years, we've seen that research and innovation really accelerate. And technology is increasingly a part of this landscape. You're going to hear about many very interesting technologies this morning, including virtual reality and augmented reality, smartphone apps, brain imaging, wearables, and many more. I'm going to get us started with virtual reality and psychedelic therapy. And I'll just say there's a lot of psychedelics research going on at Harvard right now. Dr. Rosenbaum is with the Center for the Neuroscience of Psychedelics at Mass General. And as he mentioned, I lead the project on psychedelics law and regulation, or POPLAR, at Harvard Law School at the Petrie-Flom Center. And there's also a program that was recently started at the Divinity School. So I imagine that many of you are familiar with virtual reality, but I'll just give a little bit of a background. Typically, users wear a head-mounted display, and what's really interesting about this is that they become immersed in a virtual 3D environment, so that if they look up or look down or turn around, they're still surrounded, immersed in this virtual world. So this person here that's using virtual reality could be in a virtual medieval fantasy world, for example, and many people are spending an increasing amount of time in these virtual spaces. These are some of the headsets that people can purchase. On the top is the Facebook Oculus Quest 2, which costs about $300 or so. The prices are always coming down. The two devices on the bottom, the HTC Vive and the Valve Index, cost about $1,000, and I'm sure we'll see prices falling significantly in the next few years. Facebook recently announced that it's going to be transitioning. It might be changing its name, actually, transitioning from a social media company to a metaverse company. And what that means is that Mark Zuckerberg wants to build this large virtual world in which people will work, play, and communicate. And Facebook is spending billions of dollars, and it's assigning about 10,000 employees to build this metaverse. This is augmented reality. This is a little bit different. Instead of being immersed in a 3D environment, you're essentially putting a three-dimensional object into your own space. So you could have a tiger in your backyard or a parrot in your dining room. And the devices that create augmented reality are a little bit different. Instead of wearing a bulky head-mounted display, increasingly you can wear a much lighter, smaller pair of smart glasses. On the top are 2 smart glasses created by Facebook. And on the bottom is the Microsoft HoloLens, which is more of an industrial device. And you can see here an architect is manipulating a virtual model of a building. There are many clinical applications for virtual reality. Here, a soldier is immersed in an environment that has stimuli that may provoke anxiety. And this person is holding a model of a firearm that would actually be represented in the virtual world. So that adds to the immersion. This is from an article released by the US Army, and this is an area of active research for exposure therapy for post-traumatic stress disorder. You can also conduct exposure therapy for phobias, like a fear of flying, heights, or animals. This is a game called Ritchie's Plank Game, where people actually put down a wooden plank on the floor so they can feel the plank with their feet, and they feel as though they're walking on a plank 30 stories above the ground. They can see the traffic below them. This is a game people play. I wouldn't necessarily use this for exposure therapy, but I think it illustrates the concept quite well. This is that same game from another perspective. So I want to talk just a little bit about psychedelics. These are some of the common psychedelics. MDMA is currently in phase 3 clinical trials for PTSD. Those are being overseen by the Multidisciplinary Association for Psychedelic Studies, or MAPS. Psilocybin is in phase 2 trials for major depressive disorder and treatment-resistant depression. And ayahuasca, which contains NN-DMT, there aren't as many trials going on with ayahuasca, but people often travel to South America to attend ayahuasca ceremonies for PTSD. For example, there's a group called the Heroic Hearts Project that helps send veterans down to South America to participate in these ceremonies. And ibogaine is a substance that has great potential in addressing substance use conditions. This is another example in which more research is needed. So there are many interesting opportunities to do research on psychedelics. And there are opportunities to combine them with virtual reality. And usually when people are administered psychedelics, it occurs in 3 distinct sessions. First, there's a preparatory session where a therapist discusses what the patient or research subject might experience during the next session, which is the administration session, when the psychedelic is actually administered. And then after that, there's an integration session where the therapist and the patient talk about the experience and try to interpret it. So one way that virtual reality might be useful is to provide a simulation for what the patient might experience, so that if they have not had a psychedelic experience before, they might be a little bit more prepared for the perceptual disturbances that can occur. On the left is a virtual reality game called LSD Simulator that's supposed to simulate the experience of taking LSD. On the right, this is not a game, but it's just a representation of what some people say they experience when they take DMT. Some people say that they are completely immersed in a cartoon-like world, and they sometimes even report meeting entities in this world. You can imagine this could be quite a shocking experience, and so virtual reality might help people prepare for that. Another area in which VR could be useful is during the administration session to establish what's called set and setting. These terms refer to a person's mindset and the surroundings when they're going into a psychedelic experience, and they're believed to affect the outcome of that psychedelic experience. And the great thing about virtual reality is you could put a person into any environment they like, whatever they might find most comforting. And so a lot of psychedelic therapy is done in a very sterile hospital or clinic setting. So a lot of effort goes into trying to make those surroundings as comfortable as possible with the furnishings and decorations. But with VR, really, there's no limit. A person could go anywhere in the world or anywhere that designers can imagine. Another possibility is to use VR during the integration session. A person could actually relive certain aspects of the administration session during integration, and that could potentially aid the integration process. Of course, this is really unknown. It's hypothetical, and the research needs to be done. But it also might be possible for a person to revisit the experience later at home through their own virtual reality device that could potentially reinforce or prolong the effects. One of the very interesting features of psychedelics is that they often act very rapidly, and the effects can be prolonged. Some people report experiencing benefits 6 months later or more, and it's possible that this person might be re-experiencing part of that administration session at home. And it's very possible that psychedelics and VR might act in a synergistic way. I showed these images of the augmented reality tiger and the parrot. What's so exciting about this is you could put people into situations that might not be practical, or they could be dangerous if you were to actually, you wouldn't put someone in front of a tiger, or you might not take them to the top of a building to address a fear of heights, but you can do that in virtual reality. And psychedelics actually promote neuroplasticity, as Dr. Rosenbaum mentioned. And so people often report feeling more open, and it's possible that the psychedelic and the VR could act in a synergistic way to increase the therapeutic benefit. These are some of the risks I just quickly want to mention. Because you're recording so many different streams of data through virtual reality, and people are in an altered state of consciousness, there are some privacy risks that are worth raising. A lot of these devices track people's movements because you have sensors in their hands, you may have sensors on their extremities. The devices can track their movements, their flexibility, their gaze, their gait, their balance, and many more. And people will increasingly spend time in this metaverse that companies like Facebook are creating. Now, all of these streams of data may actually be useful in a clinical setting, but what's happening is we are putting these technology companies, we're inserting them in between the doctor-patient relationship. They're acting as intermediaries. They may not care as much about privacy, and privacy laws in some cases, like HIPAA, may not apply to them, and so this is a concern. There's also a risk that VR may be overstimulating or anxiety-provoking. There are reports of people who have used VR that have found it to be quite frightening when they're on psychedelics. It seems that that is usually when they have less control over the experience. So it may be that ensuring that the user or the patient has control over where things are going, that might help to reduce anxiety. These headsets are also quite bulky. They can become uncomfortable. A psychedelic experience can last for 6 hours or more. And so it's unlikely that patients would want to wear a VR headset for that length of time. It probably would not be desirable. So they may be used more at key moments in the administration session, maybe for no more than half an hour or so. And finally, both VR and psychedelics can cause nausea, so using them together could make things worse, and some people appear to be more sensitive to this than others. I'll leave you with this. I'm a law professor, so I like to think a lot about making rules. And right now, there are no standards or best practices for using virtual reality with psychedelics, so it's important to start thinking about that. There may be ways to mention and even incorporate VR into the screening process for psychedelic therapy and into the informed consent process. And there should be guidelines established for responsible data collection, storage, and sharing. So this is just an area of increasing interest and exciting research opportunities. I encourage you to read more about it and to get involved. I think there's great opportunity here, both for scientific discovery and to really help people. So I will end there. Thank you very much.